Welcome to Between Two Psychs, a podcast where two psychologists and Board Approved Supervisors deep dive into many of the questions and challenges that provisional psychologists and early career therapists face in everyday practice, during training, throughout the internship, and beyond as they progress into working more independently. Your hosts, Isabelle Tombleson and Claire Trevitt, talk about a range of topics, specifically relating to psychologists and therapists who are just...
We're going to talk about placement red flags.
We are indeed, yes. So this is predominantly for people who are either completing training in either psychology or any kind of counselling or psychotherapy where you're required to complete a placement. And also in Australia, if you are completing an internship pathway where you are in a paid position that counts towards a psychological placement, as in the 4+2 or 5+1 program, where that placement will be providing you with the necessary experience for you to be able to work towards general registration as a psychologist.
Yes, so it's anywhere where you are paid or not paid while you are a provisional psychologist or a mental health clinician in training, social worker, whatever it might be, psychotherapist. And the purpose of you being there is to learn how to do the job.
It certainly is. And so it's a really important process, and it's really important that you can feel comfortable and supported in this process. So one of the first things that I think, and this sounds so obvious and should go without saying, but one of the first things that I really would encourage people to consider, is this placement going to enable me to meet all the requirements of either the placement journey or the placement module that I'm required to complete as part of my studies, or is it going to enable me to meet the required competencies if you're working towards general registration? Because we really do want to make sure that the duties in those roles are suitable for your development.
And there can be many different ways that placements may be set up, or people who are providing the placements may think it's appropriate for you the activities are appropriate for you to do. But as the people who are receiving the training, this is the first opportunity for us to embody that professional integrity and to really make sure that the placement is providing all of the areas of competence that we need to develop. And just one example I can think of off the top of my head is, say, for example, you find a placement and you're on a 5+1 program, so it's for a year. And so you might be employed or you might not be getting paid, but you're there for a whole year. And usually we are required to gain experience like across the lifespan, for example. But let's say this placement is only working with an adult population and you don't have any opportunity to work with children or young people. That would be a time where, if I was your supervisor, I would be encouraging you to think about, where can you go to support your learning? How can that workplace provide you with an opportunity to access working with people across the lifespan, so that you don't come to the end of your placement and not have any experience working with children, for example?
That's a great example, and that could be a great placement. So that could be a really good placement that offers really good experience, and it may just need to be supplemented with another placement. So sometimes we don't necessarily want to throw it out just because it doesn't meet all the requirements.
And many places aren't going to meet all of the requirements, let's be real.
Yeah, but it's identifying what requirements are being met. And some of the requirements that I'm very strict about placements needing to meet are the opportunities to be observed with real clients, because as part of an internship, you are required to record sessions with real clients. And so it's really important that placement's going to allow you to either record sessions or live stream sessions, or have a supervisor on site that will be able to observe those sessions. So if you've got a placement, for example, where there's no other supervisor on site and you're not allowed to record sessions, there's no way that you can actually meet that requirement.
That's a big red flag.
You'll get to the end of the 6 months and your progress report will be due, and you'll be saying, oh, I couldn't do this observation component. And AHPRA are not going to say, oh, that's okay, your workplace won't allow that, so we'll allow that concession. They'll say, you need to find a way to make that happen. So that would be a placement that would not be allowing you to meet that requirement. The other requirement as well is that you need to be seeing clients that are going to enable you to write up some cases, able to see people for a series of sessions or a full assessment session, and for you to be able to document that experience. And so if there are no opportunities for intervention or assessment because you're sitting on the phone all day taking intakes for other therapists, or you're required to take people shopping, which doesn't necessarily, sometimes that can involve a level of in vivo exposure, for example, but sometimes the duties are not necessarily therapeutic in nature. So really making sure that a placement will allow you to meet those competencies. It's not about the job title, it's about the duties.
Yes, and sometimes when we are a provisional psychologist or a training therapist in a placement, there can be a level of vulnerability when we're in a situation where there might be a bit of a power dynamic. It can be very stressful finding a placement if that responsibility is placed on us. And there is now more and more master's level and professional psychology training programs now that require students to be responsible for finding their own placements. I think that could be really quite stressful. So you're already in a vulnerable position where you're needing to find situations where people will allow you to come in and work. And I do think that means that having uncomfortable conversations or learning how to negotiate with our potential employers or placement providers is a really maybe underdeveloped skill because of our level of the development and now maybe our professional maturity at that time. So sometimes we can inadvertently be taken advantage of, or inadvertently not know how to have that uncomfortable conversation in order to advocate for ourselves. And I just want to normalize that this is actually happening more than we would want it to. I don't think sometimes that we are considering the placementee and the person who's coming in to participate in our services sometimes. And that could be for a number of reasons. Often it's just due to being so busy and overwhelmed. Mental health services are so stretched and in demand.
Absolutely. We also don't want them to feel overstretched and be in a position that whereby they are really extending the limit of their current level of skill. And that would be placing people in with very complex clients and without support or training. So saying, for example, saying, oh, there's a manual out the back. If you read that, then you'll know how to treat this particular condition. I'll do this webinar on trauma-informed care, and then you'll know how to treat trauma, for example. So
can I provide another example as well? If you're going to say do a placement in a private practice and there's an arrangement for you to receive supervision on site, but then the supervisor's delaying your supervision sessions or rescheduling them, or when you are having them, you're not able to set your own agenda so that you can have your needs met. There's maybe the supervisor's dominating and doing a lot of talking, and you're sitting there going, oh, I need help with these clients. I've got all these questions, but not able to advocate for yourself because of those situations. They would also be some red flags.
Yes, your supervision needs to help you meet those competencies, not necessarily to just be focused on workplace processes. Some of those are important, for example, record keeping or note taking, and they certainly would relate back to the competencies, but sometimes workplace factors can really override the clinical development of skills. I think that's really important. The other thing that I see far too frequently is calendars being overloaded. And there's a sort of a requirement to complete a certain number of billable or face-to-face sessions. So I would be looking at, for a provisional psychologist, I would be saying starting off around 3 or 4 ideally and building up to 5 per day. But I personally, as a registered psychologist, would not be seeing more than 5 clients per day. And I certainly wouldn't expect a provisional psychologist to be seeing more than 5 clients per day. I know sometimes there are arrangements in place where people might see 6 clients per day for 3 days, and then they might have a full admin day or something like that, but just making sure that there is sufficient time for admin, because I speak to a number of people who are spending their days off. So they're working 3 days a week and they're spending their day off completing records, writing up case notes, writing up reports, filling out documentation, logging all of their details in the work system, not to mention all of the logbooks and everything that need to be completed as part of the internship.
Yes, these are some really tricky and dangerous, I think, situations that some people who are going on placements might find themselves in.
Yes, because sometimes there can be a culture of we all see 8 clients a day. That's the industry standard. It isn't.
Can I just say that's not the industry standard, is it?
No, it's absolutely not the industry standard. But that can be the message, I think, that can be applied sometimes. Just as a guide, the British Psychological Society recommends 20 clients a week for a full-time working week. So that's around
That's 4 clients a day.
clients a day. That will be based on somebody working in an organisation. There will probably be meetings and associated paperwork, but yeah, 20 hours a week. So I would think that 5 clients per day at an absolute maximum, because there is other work to do. And particularly when you're a provisional psychologist, you have got a lot more preparation. It takes a lot more time to write up case notes. And also there's a lot of research that might need to be done in between sessions, because a client may present with something and you might want to go and check the DSM and see whether or not it meets criteria. All of that takes time. A GP might want you to call them. A parent might want you to call them. You might need to send an email back to somebody.
Not to mention needing time in those early weeks to talk to someone as you go through all of that.
Yeah, debriefing in the workplace is also really important, because we do hear some distressing material and we don't always know when that's going to come. So you may be allocated what feels like a very straightforward presentation, and then of course there's a disclosure during that session that can be sometimes the first time you've heard that type of information, or you might be questioning, did I do the right thing? There might be a risk to assess. There may be, sometimes clients may not be ready to leave the sessions, particularly in the early stages when we're not necessarily as equipped in terms of seeing those signs early on. So there could be times when there isn't a psychologist, but it needs to be somebody who's adequately qualified to provide that support. And I have seen provisional psychs in placements where they have been the only provisional psych and they've been provided with excellent support. But I've also heard of placements where there are no other psychologists. We're working with maybe a couple of OTs and a speech therapist. And then, of course, there's documentation to sign and there's no one there to co-sign. So the supervisors are co-signing all of the reports. And these things can be quite onerous, I think, on the provisional psychologist.
And a little bit risky as well.
Absolutely.
Yeah. So risk comes into all of this, like risk for our clients, managing risk, knowing what to do when we have disclosures, if there are disclosures of a risky nature, people who are feeling suicidal, for example, being able to talk through those cases with someone who's adequately trained and who can advise you on a senior level will be super important. And yeah, so that's like something else to consider as well, like how are you going to manage any risk if you don't have anyone to talk through those situations with on site.
Yeah, all of those things, there really needs to be somebody on site that you can depend upon who is available, even if they're not your primary supervisor.
Yeah.
Another red flag for me is where people are not allowed to complete supervision in work time.
Oh,
I feel as though that it doesn't value the role of supervision, and it doesn't value the role of the provisional psychologist as needing to be in supervision. It's part of the internship hours. It's part of when we log every 6 months on those progress reports, we count the number of supervision hours, and there needs to be 1 hour of supervision per 17.5 hours for the 4+2, 1 in 17 hours for the 5+1. I assume it's quite similar on placement masters. And so I feel as though for an internship, being allowed to complete supervision, even if that time maybe is made up in some way, but actually allowing the supervisee to attend supervision as part of their required duties.
An acknowledgement that it is just part of them being on the job. Yeah.
I've heard of situations where people say, oh, look, I work from 8 till 6, and so I need supervision after work. And I'm not about
but this is part of work. Yeah.
part of work. And it really prohibits the choice of supervisor. And it's, yes, sometimes it making up that time, but a lot of people I work with, they can use that supervision time in the workplace. And to me, that really values the role of supervision, because if supervision was provided as part of the employment, you wouldn't be staying back for that. You'd be doing
Yeah. Yeah. Let's talk about some other red flags. If anyone is noticing that they're feeling uncomfortable in the workplace, like if they're experiencing any level of discrimination or anything of any other nature, just as we've discussed, the nature of being a student or a trainee is that we are in a vulnerable position sometimes, and there can be a power dynamic with those who we are on placement with or receiving placements with. So yeah, just want to acknowledge that can sometimes happen, and please know that yes, there should be some supports available to you either through your university or through your supervisor or even through your peer cohort. If you're not sure where to go, please know that there will be a safe person that you can discuss this with and work out, like, what is this level of risk that I'm experiencing here? Is there a risk to my well-being, and does something further need to be done with this?
Yes, and if you are feeling something, listen to that.
Yeah.
If you are uncomfortable, it's usually either because you're not fully understanding something or because there is a genuine issue there. And that could be in relation to ethical practice. If you're required to do something that you don't feel comfortable with, then always pass that by with somebody objective. If there's somebody within the organisation that you can discuss that with, for example, if you feel as though, you're breaching boundaries or whether there are ethical issues, or if you're feeling as though you're not equipped. So for example, if a supervisor, workplace manager is asking you to complete an assessment that you're not trained to complete, and feeling as though you're able to say, look, I haven't completed the required training for that, and then that therefore
and having that be respected.
Absolutely. And if it's not respected, then of course that's a huge red flag, because then you are being placed at risk. But also it can be very undermining and you can begin to question yourself. And really, we want you to be listening to your own instincts. Even if it turns out that you were worried about something and it wasn't founded, it's better to discuss that and have the conversation and have an understanding of what your questions and concerns were. And if you're in a workplace where you're finding that you're not able to do that, then just thinking about what it feels like to go to work every day. Because there are some great placements, but there are also some very toxic workplaces.
Yeah.
And we want you to be in a good one.
Yeah. You're more likely to have a fulfilling, safe, and enjoyable career and not experience burnout if you're in a supportive workplace. So yeah, this is to let you know that we are thinking of everyone who's experiencing or has experienced a difficult workplace placement or workplace. And yeah, please don't feel like you need to be silent about it.
Absolutely, because it can feel very threatening when you're in a position where you are depending on this organisation to provide you with what you need, and it's hard to find these placements.
Oh, it's so hard to find the placements, and you've been training for 4 or 5 years to get to the point where you're on placement, you're so close to finishing. If I can just grit my teeth and get through this, everything will be okay. I know, and I'm sure that there are probably thousands of us who have done that in order to get through placement. Claire and I are wanting to highlight this. It is an issue. It doesn't have to be this way moving forward. There's a lot of big cultural shift now in our society worldwide about how we treat people and how we respect people and how we perform our professional duties in a way that is safe for everyone. And maybe not everyone's going to get it right the first time, but being able to have that conversation and to reflect on your experience and share the impact of the experience with those people who are around you is a great place to start. And yeah, learning how to speak up for ourselves in a way where we can have our needs met, and we can say to a university or a training provider, this placement is not safe. It's actually not meeting my needs professionally or personally. It's risky, whatever it might be. And putting that back on the training provider to say, look, we need to find alternatives, or it's not or you need to give me time to find another placement here because this one's not appropriate. And also, don't send anyone else to this placement until these issues have been addressed.
Yeah, because ultimately then that's going to impact people in the future as well.
And our clients.
Yeah. And like you say, really, it can be really difficult to speak up. And if you're not comfortable speaking up, or you're feeling undermined, or you're feeling threatened in some way, and I'd really hope that people wouldn't be feeling this way, but I know that that can be the case sometimes. Having a supervisor or a peer or some support person who is able to really back you, because sometimes you can begin to feel as though it's your fault, it's something that you're doing, and you begin to really doubt yourself. And in the same way that we would be supporting our clients, you need that level of support as well. We want you to feel able to trust yourself and to trust what you need. And sometimes it might be, this placement isn't interesting to me, it's not helping me, it's not fulfilling. And even those questions, they're not dangerous, but even those questions are important questions for you to be asking. So I just would really encourage you to just tune in to what you're noticing inside for you. And there is a lot of help and support available. And as supervisors, we don't want people to be in these placements that are not meeting your professional needs.
And your safety needs.
Safety needs, absolutely.
Yeah. All right, Claire, heavy episode for our listeners today. And we thank you all for listening. Please support each other, and please talk to someone if you've listened to this episode and you feel like you need some extra support today. Please reach out to someone.
Absolutely. Yes. As I said, Isabelle, we're all here to support each other.
We are. Yeah. Okay. Well done, everyone. Keep doing what you're doing. Thank you, Claire.
See you next time. If you enjoyed this episode, please take a moment to leave us a 5-star rating. It really helps others find the show. And don't forget to follow us on Instagram at Between Two Psychs for more updates and resources. For more information and to explore everything we offer, head over to our website, betweentwopsychs.com.au. We appreciate your support, and we'll see you next time.